Here's a list of my courses, and let's choose the course talking about the USMLE cases and quizzes. And let's scroll down the cases and choose, for example, this one. In this case, we have a 34-year-old pregnant patient who went into labor. She was diagnosed with preeclampsia at 22 weeks of gestation, and at the emergency department, she was given the appropriate medication for her condition. These included penicillin, steroids, and magnesium sulfate. Soon after, the patient deteriorated, and immediate cesarean section was performed. What is the indication of steroids in this patient? The key features: so we have a 34 weeks pregnant patient, and she went into premature labor. There is a history of preeclampsia, and she was given penicillin, steroids, and magnesium. She also had cesarean section. This is consistent with premature rupture of membrane with complications. In premature labor, we give the patient antibiotics and steroids regardless of the gestational age. So it doesn't matter how many weeks the patient has been pregnant, we always have to give them antibiotics and steroids. Of course, assuming that they went into premature labor. Magnesium can be given to patients with preeclampsia to prevent the occurrence of seizures. And if the patient was more than 34 weeks pregnant, we just deliver them right away. If they were less than 34 weeks pregnant, we give them the appropriate medication that we mentioned, and then we wait till 34 weeks, and then we deliver. Antibiotics are given to prevent infections, which are very common in this stage. Steroids are given to accelerate the lung maturity. And magnesium, like we said, is given to prevent eclampsia or seizures in patients with preeclampsia. Here are the guidelines. And if we go back to the question, we do see accelerating fetal lung maturity in one of the options. And indeed, that is the right answer. Use the link below to get access to the full course, including many cases and hundreds of quizzes. Everything in the course is high yield and common topics that we see frequently in the exams. Basically, we sat down and looked through a large number of question banks, quizzes, and many repeated exams. The topics we've chosen for this course are the most repeated topics, so they are very, very common. Thank you for watching.